It's great to welcome to the program today for the first time Kentucky Governor Andy Beshear. Governor, it's so great to have you. I appreciate the time.
Thanks for having me on. Very excited about it.
So I think to start with, when I speak to senators and members of the House of Representatives and they talk about this tax bill that is now potentially working its way through the Senate, their view is sort of from the top down, what can we do in order to maybe prevent the bill's passage or potentially to get what we want in the bill? As a governor, you're in a different position where you're sort of downstream dealing with the effect of such a bill on constituents in terms of the programs that are or aren't funded in the bill, what happens to taxes and how that affects individuals and businesses in your state. Talk a little bit about, as a governor, how you deal with such a bill or how it affects your state and how that kind of differs from those in DC, if you can.
Unlike those in D.C., I, as a governor, actually have to live with the consequences of what they do and what they pass. And this bill is devastating to Kentucky, but it's devastating to all of the United States of America. Just the Medicaid portion of this bill will kick 200,000 of my citizens off their health care coverage. It'll fire 20,000 of my health care workers, and it'll likely close 35 rural hospitals, each of which is the second largest employer in the county that they're in. So that devastates people's lives. That devastates their productivity as they're taking parents whose long-term care costs were covered by Medicaid back into their homes. It devastates the economies of our communities that depend on those hospitals. And it makes people, whether you have private insurance or on Medicaid, drive a couple of hours just to see the same doctor you used to be able to see in your community. Meanwhile, it cuts food assistance for people who are going hungry. And most of our food assistance goes to seniors and kids. So it's making more people's parents and children go hungry. And it blows a hole not just in the federal debt, over $3 trillion. It pushes a lot of costs to states that have to balance their budgets and blows a hole in those as well. I have never seen a bill like this that is going to cause so much harm and devastation and see so many people who are elected to represent the people in their communities just act like what they're doing is not going to harm the people they represent.
One of the sort of maybe complicated things about being a Democratic governor in a red state is that we've seen, if we look back at 2010 and what happened with the Affordable Care Act and the Medicaid expansions that states maybe did or maybe didn't do, is that very often blame ends up misplaced in following or subsequent elections. And this isn't all about winning elections by any means, but I do think it's important for political actions to have consequences. So I would love a little bit of insight into, you have a lot of Trump supporting constituents in your state that are also your constituents, not only Donald Trump's. And in my experience, there's a predisposition to blame Democrats when things don't go well if you are a Trump voter. And so I'm curious about how you're thinking as to how people are going to interpret what happens as a result of this bill, and whether on some personal level there's concern that you're going to be the recipient of maybe misplaced blame to some degree.
There's no question that the way that they set this up is to claim they're not laying off healthcare workers or they're not cutting Medicaid and then push that to the states, Democrat or Republican governors, and try to shift blame. But nobody's going to be fooled. Donald Trump is talking about his big, beautiful bill. He is owning every piece of this. And it's the nonpartisan congressional budget offices that are putting out these numbers, these facts, not even just projections. They're believed to be facts about the damage that it's going to cause. I'll give Trump one thing. His policies are terrible for the American people, but he owns them. Tariffs are impacting our economy, are making small businesses lay people off. But Donald Trump stands there with the giant board and owns tariffs in a way that I've never seen someone own such a negative policy. The same has to be true on this bill. If my two senators, though I think one is going to vote against it, vote for this bill, they are responsible for firing 20,000 healthcare workers. If our House members vote for this bill when it goes back. They are responsible for closing 35 rural hospitals, and all of them represent rural areas. Your actions do have to have consequences, but I will say this, people understand Medicaid in a way that they didn't 20 years ago. Medicaid covers the people we love the most, our parents and our kids. 50% of Kentucky's kids are covered by Medicaid. Over 40% of our births covered by Medicaid. 70% of our long-term care costs for our parents and grandparents are covered by Medicaid. So when they talk about 16 million people getting kicked off their coverage, 200,000 Kentuckians, guess who they're going to be? They're going to be our seniors and our children. And the way that they're going to do it, where you have to check extra boxes, is kicking people off for 6 months because you didn't check this box or that box. It's wrong on a moral level, but it's also really bad policy that's going to hit our economy really hard.
Is there evidence from your state that so-called able-bodied Americans are abusing Medicaid as a widespread problem? And I think to couch that, it's important to contextualize. Any social welfare system is going to have some what we might call free riders. And most economists understand that if the system is well tailored to the population and to the circumstances, you can't get that to zero, but it doesn't really matter. Like if you can find one anecdote, that doesn't really change the overall effectiveness of the program. But even understanding that, is there evidence of these so-called able-bodied Americans that are just abusing Medicaid and getting benefits they shouldn't really qualify for?
No. When you look at this program, what it has done is expand healthcare across the United States, has made sure that our people are healthier and more productive. I believe more people are able to enter the workforce because of this coverage. You look at Kentucky right now, we have the most people working, the most jobs filled, and the largest workforce we've ever had. And we have over 1 million people covered by Medicaid. Now, our goal is to eventually move them off of Medicaid, but if that gets us healthier and more productive, then it's such an important tool. And there are already ways to find and to fight the fraud and the abuse. I was an attorney general. We all have Medicaid fraud units that work every single day. But the fraud and the extra cost aren't on people that shouldn't be on it. It's on certain providers that are breaking the rules and are ripping off the American people. And that's where we need to go to find the savings. We need to look at prescription drug prices to get out there and to find the savings. But what we shouldn't be doing is kicking people off of health care that's getting them well enough to work, or is taking care of that special needs child, or is making sure that a family doesn't have to, someone stop working just to take care of a relative. It does such important things. And just remember that it also boosts employment in the economy. Healthcare is one of the fastest growing sectors in our American economy. And if you cut out a ton of revenue from a fast growing sector, you are going to not only slow down that growth, you're going to reduce its employment.
I find there's an analogy here to that around undocumented immigrant labor, and I'll explain what I mean. We often hear so much from the Republican Party about individuals who are here undocumented and are working, right? They're putting in a day's work. And we hear not nearly enough about the companies that are employing large numbers of those workers against the law. So the focus is on one person who came here to try to make some money to help his family. And similarly, when we hear about Medicaid and Medicare fraud, and we heard about this through DOJ, about individuals, what this ignores is that there have been, not just in your state, but all over the country, when we really talk about the fraud, it's the providers that are figuring out ways to do mass fraudulent billing or to even bill for services that haven't been provided. It seems as though it's another way, when you look at climate, is it the individual with the plastic straw, or is it the huge corporations that are doing the polluting at a mass scale? This is something we see very often, which is shifting the focus to the individual.
There's no question that the Republican Party right now is using individual stories to demonize large and important programs, hoping the American people will get so caught up in the outrage of how could one person do this or that they don't see the widespread damage that's being caused. But the other thing that it does is it shifts the focus off actually fixing the system that needs to be fixed. When we look at Medicaid, if there are challenges, they are of the larger healthcare system, that things cost more in the United States in healthcare than they do elsewhere. We need to actually drill down and fix that. You look at immigration, and we don't have enough of certain visas and certain work programs to fill jobs that are out there to ensure that the math works from the workers that we need and the programs that we have. In many ways, it's Republicans not governing well, because governing well is finding the fix and finding the solution, not just trying to break something in government, but to actually make it work better. Now, as a Democrat, I've got to admit that there are times where we could have and should have done better. There are areas that have been over-regulated to a degree to where we can't get the job done that we want to provide to the American people. The BEAD program is a great example. You know, Internet for all, the billions of dollars are appropriated, but none of it is in the ground because there were just too many steps and too many regulations. So we as Democrats have to deliver. We have to understand that our job is to meet the basic needs of the American people, and healthcare is one of the most important of them. But we can't just talk about it. We can't just defend it. We've got to get out there and actually make it more accessible to people. That's why I expanded Medicaid for vision, hearing, and dental. And for me, it was pretty simple. If we want somebody to go to work, let's give them a pair of glasses so they can see well enough to drive to work.
I want to expand a little bit on your critique of the Democratic Party, because I think as governors, you and other governors we've spoken to are sort of in a unique position to say, hey, I'm the administrator here and I'm dealing with the waterfall effect of what's happening in DC. We recently had New Jersey Governor Murphy on, and he outlined what he saw as the failings of the Democratic Party in November, objectively losing the White House, the House, and the Senate. I would love to hear from you a little bit. What do you believe led to that wholesale loss at the federal level? And what do you think Democrats need to do differently going 26 and certainly 28?
Democrats have to be the party of common sense, common ground, and getting things done. We've got to recognize that when people wake up in the morning, they're not thinking about their party or the next election. They're thinking about their job and whether they make enough to support their family. They're thinking about the next doctor's appointment they have. They're thinking about the roads and bridges they're going to drive that day, the school they drop their kids off at, and whether they feel safe in their communities. We've got to understand that as much as people may care about another issue, if they're struggling to pay for their child's prescription, you can't get to anything else. And that last election showed, even if people may fundamentally disagree with the candidate on a number of issues, if they believe that candidate will make paying the bills just a little bit easier when they're struggling, they're willing to vote for him or her. So we've got to be that party that has a relentless focus. And the lane is there, because while Trump promised he'd bring prices down, he's doing anything but that. His tariff policy is the single most devastating policy I have seen in terms of prices or people's everyday ability to pay the bills. His pulling back grants on infrastructure is making that next project that could shave 20 minutes each way on your commute that much harder. This big ugly bill and what it's going to do to healthcare is going to make people's lives a whole lot more difficult. So the lane is there, but we've got to be focused. And let me say there's two other things I think Democrats need to do.
Yeah.
We need to talk to people and not at them. We need to stop using some of the overly sanitized words because they just don't mean the same thing. In Kentucky, we got hit hard by addiction. We've all lost so many people, and you know what we call it? We don't call it substance use disorder, we call it addiction, because addiction is mean and it's difficult. And so when last year we had a 30% decrease in drug overdose deaths, thank God, that was making ground up and maybe even seeing the light at the end of the tunnel in fighting addiction. Think about the big ugly bill. We're not going to win if we say it's going to increase food insecurity. What it's going to do is cause people to go hungry. And I think the last thing we've got to do is explain our why. We're very good at the what, at what our policy position 3, sub-point 2, bullet point 3 are. But why do we believe it? For me, it's my faith. I vetoed a lot of nasty anti-LGBTQ legislation in my state, and I explain why every time. It's that I believe that every child is a child of God, and if a legislature is going to show people hate, I'm going to show them love. If they're going to show them judgment, I'm going to show them acceptance. And I especially don't want people picking on groups of kids. And it's when you share your why, people can even disagree with you, but respect it. They know where you're coming from, and maybe it creates just that space to where they start thinking a little bit differently. Those are things that we as Democrats haven't necessarily done well, but have to if we want to win. And I believe it's the formula that can not only get us back, but maybe even bring the Republicans back in to a more common ground area, because all those core areas are good for everybody, regardless of your party.
Governor, I know you've got to run, but last question on that idea that you lay out and maybe bringing Republicans back in. It seems plausible that McCain-type Republicans might be brought back in by that type of thinking and that type of talk. But is this MAGA movement simply too extreme to really fold into anything that would be a functional movement, and it's going to take getting MAGA out in order to do that?
I think that even those that proclaim themselves as part of that movement still care more about their job and the ability to get their parents or their kids to the next doctor's appointment than they do about any of the rhetoric. I think this is all about showing people that you want to make their life better and then proving it. Getting out and building the 2 largest battery plants on planet Earth, which we've done. Getting out and opening that first hospital in our largest African-American community in Kentucky in 150 years. Show people you care about them and get results. And in a state that Donald Trump won by 30 points, I can win by 5.
We've been speaking with Kentucky Governor Andy Beshear. Really appreciate your time today, Governor. Thank you.
Appreciate you. Thanks for having me on.